Next on Sisterhood of the Second Act.
According to the CDC, stroke kills twice as many women as breast cancer, making stroke the third leading cause of death among women. Sabrina Royal is a certified family nurse practitioner, and she is going to join us today to talk about stroke prevention and warning signs. Patrice Freeland helps people find wellness through natural living and essential oils. Find out how you can use natural methods to stay healthy. That's next on Sisterhood of the Second Act.
Sisterhood of the Second Act is brought to you by There's more inside the hemp mill than CBD products. There's a community. Stop in for Friday's coffee talk to enjoy free hemp coffee and treats. Patent pending products made from hemp for anxiety, pain relief, and organic healthy eating. Cannabinoid products you can trust because the hemp is locally grown, processed, and formulated by us with patent pending formulations. That includes our Pet Calm and dog biscuits. The Hemp Mill, women owned and operated with nutritional offerings, local cards, gifts, jewelry, and trending fashions made by women-owned businesses. TheHempMill.net.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree for me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
See where a grateful nation remembers its heroes, and where Thomas Jefferson came to relax. Where small town charm is just down the road from big outdoor adventures. Find peace and quiet, as well as the sounds of family fun. Destination Bedford is located where the Piedmont Plateau meets the Blue Ridge Mountains of Virginia. Where ordinary ends, Bedford begins.
Where there is nothing, artists see something. Where there is silence, they hear a melody. Where there is beauty, they create even greater beauty. In a region known for its beautiful mountain surroundings, our vibrant arts community makes the Allegheny Highlands a more colorful place to live and visit. Our passion for the arts is endless, and it's uniquely Allegheny.
From the Fox Radio Roanoke Studios, here's Kathy Heberle.
Welcome to Sisterhood of the Second Act. I'm Kathy Heberle, and according to the CDC, 1 in 5 women between the ages of 55 and 75 will be suffering a stroke. Our first guest today is Sabrina Royal, a certified family nurse practitioner with New Horizons Healthcare. She's going to give us some information on strokes and what we need to know and signs that we need to look for. Welcome to our show, Sabrina. Thank you for joining us.
Thank you so much for having me.
So, I'm shocked at the statistics that stroke is the third leading cause of death in women these days.
Yes.
And what causes a stroke?
Stroke is what a stroke is. It is an interruption of blood supply to an area of the brain.
Sure.
The causes of a stroke can be where you have a blood clot or plaques in blood vessels that will block the blood flow to the brain, and then there also you can have a bleed in a blood vessel or a rupture that results in bleeding, which causes the damage to blood cells.
Sure.
As well.
Yeah. What makes a woman susceptible to having a stroke? Is there anything that's different for women than men?
Women are more susceptible simply because of their hormonal changes, whether that be due to pregnancy,
I didn't know that.
use of birth control, hormonal medications following menopause. That places a woman at a higher risk for stroke.
I didn't know that. So our target audience is generally women around 50 or older, but can women under 50 ever have a stroke?
Yes, strokes can affect women of all ages simply due to the risk factors of using the hormones.
So let's go over some of the warning signs. I think we probably should be aware of those. Could give us some of the warning signs?
Warning sign of stroke would be a sudden onset of numbness or tingling to the face, hands, or leg on one side of the body, a severe headache. You can have difficulty seeing, difficulty speaking, loss of balance, or just a lack of coordination overall.
Is there often pain with it?
Just from the severe headache. Otherwise, there would be no pain associated.
Really? Okay. We are talking with certified nurse practitioner Sabrina Royal, and we're learning all about the dangers of stroke, I guess is what what can we do to prevent strokes?
Strokes can be prevented by maintaining a healthy blood pressure, also maintaining a healthy cholesterol level, eating a low sodium, high fiber diet, and getting physical exercise, and staying physically active. So
just kind of practicing overall good health, it sounds like. And I guess the next question I would have is, my father-in-law had a stroke many years ago in 1998. Has there been any advancements in stroke treatments and therapies?
Yes, stroke treatments and therapies have advanced over the years. For specific types of strokes, there's different treatments. For an ischemic stroke where there is a blockage in the blood vessel, a medication can be given through an IV called TPA, which will resolve the clot. It's also known as a clot buster, so it will resolve the clot, allowing for the blood flow to resume to that part of the brain. In hemorrhagic strokes where there's bleeds, there are endovascular procedures that are performed where they can place either a metal clip or a metal coil on the blood vessel to prevent the bleed or prevent it from going any further.
Okay, so if you're with somebody and you suspect that they're having a stroke, obviously you're going to call 911, but is there anything you could do for the person while you're waiting?
The biggest thing is to remain calm, and that's probably the most important. And to also know the symptoms that the person is having. And the very most important thing to do if you're with someone who is having a stroke is to note the time. Time is very important for the onset of symptoms. That is information that is used in order to treat the stroke effectively.
It says men and women often present differently when having heart attacks, but I was wondering, is the same thing true for strokes?
Yes. In strokes, women can just have overall weakness or fatigue, and they also can exhibit just nausea and vomiting.
Oh, so they might not have some of the other balance issues or things like that. So does it make it harder to diagnose a woman?
It can be a little bit harder to diagnose. You kind of have to have those diagnoses in your mind when you're seeing somebody who's just complaining of generalized fatigue and weakness, or those are always on our radar as far as treating a patient with those complaints.
I understand. We are talking with certified nurse practitioner Sabrina Royal. And Sabrina, if somebody has suffered a stroke, what are some of the things you should expect to? Are things going to be different with them?
It all depends on the treatment, but there can be some differences. There can be a weakness to one side of the body, depending on if it has affected that particular side. There can be limitations as far as they may not be able to do certain things, such as their activities of daily living, like bathing, dressing.
Are there resources available for people that have had strokes that, whether it be, do they usually need like rehabilitation or therapy?
Yes, a lot of times in stroke treatment, depending on the severity, patients can have outpatient physical therapy, occupational therapy that can either come to their house, and then there's also in-house rehabs at the local hospitals where they can go to until they become stronger and learn to deal with their deficits.
Well, that sounds good. Is there resources for the family as well? Like if say your mother had a stroke and maybe now you've got to help care for her. How do you know what to do? Is there something available to help the family make adjustments, perhaps either to the environment or things like that you should be aware of?
Yes, there's always services available to family members, caregivers, and depending on where they're being treated, those would be available through the hospital where they're being treated as to what services they may need.
Okay, so for going back a little bit to the prevention, I think it was really important to touch on, like you mentioned, diet and things like that. Are there other drugs or treatments that your doctor might want to, if you are perhaps more at risk for that? Is there something that they could do, or should you just monitor like your blood pressure and things?
The main thing is monitoring the blood pressure, keeping your blood pressure at a normal level, and then with the cholesterol is always keeping an eye on your cholesterol and maintaining that at an appropriate level. Depending on your risk factors, if you have diabetes, high blood pressure, your physician may ask you to take an aspirin every day to kind of thin your blood to kind of reduce that risk as well.
That sounds like good advice. Is there anything else you could do to reduce your risk factors?
One of the main things is just staying physically active, trying to maintain a healthy weight as well is important.
Okay.
And if you smoke, you need to stop. And if you don't smoke, don't start.
Don't start. That sounds really good. Is there anything else like that? Just alcohol, or is there lifestyles that can impact? Like people that have certain lifestyles, can that impact your risk for stroke?
Yes. Like I said, with diabetes alone, if you have an inadequate control of your blood sugar and you're not maintaining that at a normal level, that can also increase your risk. Of course, use of drug and alcohol can also increase your risk just because of the issues that it causes with blood pressure and just normally is not healthy for you overall.
Certainly. So is there, in general, are we just more aware of this, or have women actually started having more strokes than, say, 100 years ago? Or are we just more aware of the signs and symptoms?
I think it's a combination of both, but I do think that more women have statistically higher blood pressures now, and there's a lot of people being treated for high blood pressure, just more now than before.
Yes.
Depression also can lead to causes or your risk factors for stroke.
Is that because of the hormones that come into play for that?
Yes.
So be aware of that not only is it not good for you emotionally, but it can also have a physical impact on you. Is that true?
Yes, ma'am.
Oh my goodness. So as we're learning about stroke, is there anything to wrap up any advice you want to give to our women, our audience listening, that, maybe a tip that they weren't aware of before they listen to our show?
One thing I would do is just to maintain a healthy a healthy lifestyle. I would always see the doctor every 6 months to a year for those checkups, those cholesterol checks. A daily multivitamin is always a good thing. If you do not already take one, I would advise that you do that as well. And then any type of physical activity, at least 30 minutes, at least 3 times a week, would be very beneficial.
That sounds great. Sabrina, thank you so much for coming in today and helping us understand this, because I do think women don't understand what risk, how likely it could be that women or somebody is going to have a stroke. So thank you for joining us today.
Thank you for having me.
And we will have all of Sabrina's contact information on our website at Sisterhood of the Second Act. And when we come back, we are going to talk all about learning with essential oils how to maintain a natural health.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree from me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
There's There's more inside the hemp mill than CBD products. There's a community. Stop in for Friday's Coffee Talk to enjoy free hemp coffee and treats. Patent pending products made from hemp for anxiety, pain relief, and organic healthy eating. Cannabinoid products you can trust because the hemp is locally grown, processed, and formulated by us with patent pending formulations. That includes our Pet Calm and dog biscuits. The Hemp Mill, women owned and operated with nutritional offerings, local cards, gifts, jewelry, and trending fashions made by women-owned businesses. TheHempMill.net. There's more Sisterhood of the Second Act after this.
Come on, you watch the news. Be prepared to pay more taxes. Then if you owe back taxes or haven't filed in a few years, get ready. The IRS, the largest collection agency in the world, will be coming after you with the power to collect taxes by any means they want to. Hey, they can freeze your bank account, your passport, even padlock your business. Oh, good times. Look, if the IRS claims you owe them $5,000 or more in back taxes and they're coming after you, don't panic. Call my friends at Get a Tax Lawyer first. Their job is to negotiate with the IRS and save you money. They're experts at it. That's all they do, and you can trust them. In some cases, they have reduced a $50,000 tax bill to less than $1,000. If you owe the IRS $5,000 or more in back taxes, call now for a free consultation.
Call 800-654-9116, 800-654-9116, 800-654-9116. That's 800-654-9116.
Once again, from the Fox Radio Roanoke studio, here's Kathy Heberle.
Welcome back to Sisterhood of the Second Act. I'm Kathy Heberle, and my next guest is Patrice Freeland, who has a business called The Wonderful Land of Oils. How did you get started in this?
It was the result of a life's journey. I was always interested in biology and how the body works. I love anything science related, even the sociological aspect of humanity. And that's always been something that's been in the back of my head. But just from a day-to-day living perspective, I was always one of those kids that was sick, just chronic sinus infections, never really felt well. And that really escalated when I got into my 20s and I went into what I call just mind-body meltdown. I had taken several antibiotics in a short amount of time and just started having all these really crazy symptoms. I was becoming allergic to everything and had chronic pain, had severe insomnia. Of course, anxiety is always a part of those things. And I had a really hard time finding answers, and it just kept getting worse. I knew I needed to try something different, and I'd heard of acupuncture, so I gave that a try. Saw Sheila Granaja, who's an amazing local acupuncturist, and that was the doorway into natural health. So I spent the next 10 years really diving into acupuncture, homeopathy, herbal medicine, any of those natural healing modalities, and I could see as I started using those more and more that I kept getting better and better. Then I was introduced to essential oils about 4.5 years ago, and that had taken the progress that I had made and just took it to a whole new level. And when I found out that I had the opportunity to become certified in this and help other people, then it was just a match. I've always been passionate about being a problem solver, helping people just feel better and live their best life, and it's been a perfect fit. It's my life's work and very passionate about it, and it's something that people really need.
I agree. And tell us, how do essential oils work?
So essential oils are just volatile aromatic compounds for plants. They keep the plants from being infected with insects, and they're antibacterial and help protect the plant, and they're a perfect match for a human body as well. And when you're using essential oils, you can use them one of 3 ways, and all of them are very effective. You can just simply breathe them in, put a drop in your hand and cup and inhale, breathe it from the bottle, or I love putting it in a diffuser, which is like a little humidifier that mists those essential oils into the air. And when you breathe them in, they affect your limbic system. So if you've ever gone to the dentist and had the laughing gas to help relax you, it's the exact same thing. So it's more than just, I'm smelling vanilla. It makes me feel happy because it reminds me of grandma's cookies. And while you do have that relationship, it's actually hitting the limbic system in your brain and telling your body to respond in a certain way. It's very powerful. You can also use them right on your skin. If you have a particular area that's hurting, like a stomach upset or cramping, headache, you can just dilute them, put them right where it hurts. And with certain essential oils that are very high quality, they have to be pure and be certified as such, but you can use them internally and they will help your body at the cellular level.
So what kind of issues can be helped with essential oils?
Well, in the oiling community, we always say there's an oil for everything. And that is true. One of the things that I really specialize in is a hormonal balance with women. And we see so many challenges, even with our, young ladies that are, just starting their menstrual cycles to when you start going through those transitions in life. Myself, I'm in perimenopause, and that whole transition into the menopause and postmenopausal years are very difficult, and they're difficult for a lot of people. And that difficulty can be a lot of different things, and unfortunately, in some instances, it can really negatively affect your ability just to live your day. And essential oils and proper supplementation can be very, very effective at helping just balance the hormones, but also help kind of remediate some of the effects that you're dealing with while your hormones are kind of out of whack and out of balance.
We are talking with natural wellness consultant Patrice Freeland. And what do people need to know when they're shopping for essential oils? Like, it sounds like you mentioned certified, some you can take internally. It might be a little bit complicated for the average person. So give us a little bit of background on that.
Yeah, absolutely. This is key. Essential oils are not regulated. So you can't just believe what's on that label. It can say natural, it can say organic, it can say whatever they want to put on that label, but that is no indication as to really what's in the bottle. And when you are shopping for essential oils, you want to make sure that you can see that those oils have been tested. It's very important that they are tested not only by the company that's selling it, but third-party companies as well. And things that they're going to test for are purity. We want to make sure that you have nothing but essential oil in that bottle. If you're getting essential oils from a discount store, then they are going to be diluted. They may have other additives or fragrances. And not only is that not going to give you the therapeutic effect that you need, but it actually could harm your body a little bit. I've even seen essential oils say that they're flammable, and that's definitely not something that you want. So testing and making sure that you have access to those test results is important, that you're working with a reputable company that is certified in some way as a therapeutic grade oil, and that company provides adequate educational resources for you, and you have visibility to the supply chain.
So how do you know which essential oil to use for your particular condition that you're trying to treat?
That's the thing I love about essential oils is you don't even necessarily have to have like a diagnosis. Is you know how you feel. You know that your stomach might be upset, that you've got cramps, or you're having trouble sleeping. And there are a lot of really great guides out there if you want to do your own research. There is a wonderful phone app called that is available through Aroma Tools called Modern Essentials, and it's just my little quick lookup guide where you can look up whatever you're feeling. It tells you the essential oils that are going to help that. And there are several books that you can get online. There's lots of articles, but I definitely recommend going to working with a certified essential oil consultant. That really is going to be your best bet. With essential oils, it's a very easy thing to use. For example, if you're using peppermint's great for relieving stomach upset, for helping you breathe better. It's great for focus and headaches. A lot of those things that happen when we are having PMS and get that brain fog, it helps make you alert. So one oil can help a lot of different things. And they also have a little bit of an emotional counterpart too, where they can help uplift your mood or help calm you down. And you just get all of those wonderful benefits in an easy kind of self-serve type of way.
I have a question. Can you combine oils?
Oh, yes, absolutely. You definitely can. And there's no rules, there's no limit to that.
So you can kind of customize if you have somebody that comes to you with a particular plethora of conditions, perhaps, like they can take more than one for different symptoms, or you can advise them.
Oh, yes, absolutely. And not only does that give you a customized solution for you, mixing oils is just something that's just really fun to do. And when you're talking about hormonal health, that is an array of different issues for different people. So, like in my experience, I mentioned I'm starting to get into those menopausal years, and my monthly cycle has started to change a little bit. So I'm noticing that I'm a lot more irritable than I used to be, that my cramps are a little more severe than they used to be, and I'm more tired. And so in that case, like I would blend clary sage, which is your emotional balancer. And I'm also going to add in something to calm me down a little bit. So I'm like Roman chamomile is great for that, which is also good for insomnia. Lots of ladies have insomnia when their hormones are out of balance. And then I might add something like a little bit of peppermint to help, deal with the cramping. And you can just mix and match those, and it gives you everything that you need in just one nice little blend.
That sounds great. We're talking with wellness consultant Patrice Freeland. And tell me, are essential oils safe to use around children and pets, like in your home?
Yes, absolutely. But you do need to make sure that you are using a therapeutic grade essential oil. That's where the safety comes into play. You do not want to use a low quality or contaminated oil in your home for you or your children or pets. But when you're using a high quality oil, absolutely. You can actually use them therapeutically on your children and your pets. You're just going to want to dilute those a little bit more to the size of your dog, cat, or horse, or your child. There are a few oils that you're not going to want to use directly on the skin of your pet, but if that's a concern, again, that's a really good reason to speak to a certified wellness consultant that is specialized in essential oils.
Sure. So how does a wellness plan help somebody struggling with health challenges as we wrap up here?
Absolutely. Every person is unique. And two people may have the same symptoms, but they may be due to different root causes in their body.
Sure.
And everybody's schedule and capacity for changing their routine is going to be different. And that's where the wellness plan comes into place, is because it is an individual plan for you and allows you to make changes over time. You're not going to be, you want to all of a sudden introduce 10 new things into your day. With me when I'm developing wellness plans is I understand what your largest health goals are, what your lifestyle is like. We look at what the root cause is, and then come up with a 30, 60, 90 day, and then a maintenance plan after that.
Okay, so it can change a little bit as you go through the oils and what you're using. And do you want to stay on a maintenance plan then, long term usually?
Absolutely.
Okay.
Your body is always going to need some type of support, and that's where nutritional supplementation really comes into play. So there are things that your body's going to need every day, but then you'll add in essential oils, and they'll change over time as your body changes over time, and as just your day-to-day life is going to bring up different challenges, and then we give you those tools to help you integrate that and just be empowered over your own health. That's what it's all about.
Oh my goodness, this has been wonderful. Patrice, thank you so much for coming in today.
Thank you so much, Kathy. It's been an absolute pleasure.
We will have Patrice's contact information on our website at sisterhoodofthesecond-act.com. And we will wrap up the show when we come back.
You are cheap. No, I'm not. You are cheap. No, I'm not. You are cheap. No, I'm not. You are cheap. Well, maybe I am.
If you're buying a diamond ring for your wife, it's not cool to be cheap. If you're buying airline tickets, it's very cool to be cheap and called Trip Amigo, where you can fly anywhere in the world and save up to 75% on over 500 airlines and 300,000 hotels. Plus, rental cars and vacation packages. Visit family, friends, or go on a once-in-a-lifetime vacation. Go ahead, be cheap. We have special fares we're not allowed to publish. When you book your airline reservations with Trip Amigo, you'll spend your travel money when you get there, not by getting there. Call Trip Amigo now and mention the travel code AMIGO and save even more. Call Trip Amigo now.
800-772-4165. 800-772-4165. 800-772-4165. That's 800-772-4165.
I want to thank Sabrina Royal and Patrice Freeland for joining us today. I'm Kathy Heberle. Join us again next week for another edition of Sisterhood of the Second Act.